Hello, my name is Sarah Tavakali, and I have 5 years of experience as an RBT. I'm currently pursuing my master's in applied behavior analysis, and today we will be discussing consent in the field of applied behavior analysis. Today's training will explore how gaining informed consent from clients and stakeholders is crucial for implementing ethical and individualized behavior analytic techniques in intervention plans designed to promote adaptive behavior and independent functioning for our clients and society. Informed consent in ABA allows for behavior analysts to build relationships with clients and stakeholders that are founded in trust and cultivate a safe collaborative environment for all of the individuals involved in the treatment process to be heard and respected. We will begin by defining consent and its relevance in the field of ABA. Then we will explore different types of consent, followed by the processes for obtaining and documenting consent. Lastly, we will cover scenarios where consent can be ambiguous and come together to discuss appropriate options when responding to these difficult situations. According to the BACB Ethics Code for Behavior Analysts, consent is defined as the permission given by an individual with the legal right to agree to participating in services or research, or allowing their information to be used or shared by ABA professionals. Assent is defined as vocal or non-vocal verbal behavior that can be taken to indicate the willingness to participate in research or behavioral services by individuals who cannot provide informed consent due to age, physical impairments, or intellectual impairments. ABA involves close interactions with vulnerable individuals, which include instruction, prompting, data collection, behavior interventions, and changes to the environment. Clients of ABA are often members of vulnerable populations, including individuals with developmental, intellectual, behavioral, and communication differences. Obtaining informed consent helps practitioners prioritize our client autonomy, safety, dignity, and promotes least restrictive practices, helping build trust between clients and practitioners. Obtaining informed consent also ensures that we engage in proper practices with regard to building rapport, maximizing client and stakeholder engagement in the treatment process, and reduce stress, decrease legal risk to the practitioners, and promoting socially valid and uniquely meaningful services to our clients and family members. Consent is never just about gathering a signature on some documents. Initial signatures on intake forms do not equate to meaningful ongoing consent throughout the treatment relationship. Here we have some questions to begin thinking about how and when consent should be given, what that might look like, and how to manage ongoing consent and assent. Here we have the portions of the BACB Ethics Code for behavior analysts that are relevant to informed consent within the field. Section 2.11, obtaining informed consent, states that behavior analysts are responsible for knowing about and complying with all conditions under which they are required to obtain informed consent from clients, stakeholders, and research participants. Section 3.1, responsibility of clients, states that behavior analysts act in the best interest of clients, taking appropriate steps to support client rights, maximize benefits, and do no harm. They're also knowledgeable about and comply with applicable laws and regulations related to mandated reporting requirements. Section 3.10, limitations of confidentiality, states that behavior analysts inform clients and stakeholders of the limitations of confidentiality at the outset of the professional relationship and when information disclosures are required. Section 6.4, informed consent and research, states that behavior analysts are responsible for obtaining informed consent and assent, when relevant, from potential research participants under the conditions required by the Research Review Committee. There are 5 different types of consent within the field of ABA. We have informed consent, which is when individuals are fully aware of all the information related to what they're consenting to before providing that consent. This includes clear explanations of services, risks, benefits, alternatives, limitations, and data usage. Explicit or expressed consent is when an individual agrees to the collection, use, or sharing of their personal information through clear verbal or physical actions. Implied consent is when consent can be inferred from an individual's actions without them outright expressing their agreement to participate in something or share personal information. However, in ABA, we must take caution to remember that implied consent should never replace the acquisition of explicit informed consent from clients and caregivers. Assent is vocal or non-vocal verbal behavior that indicates an individual's willingness to agree to participate in services and activities. Assent is critical for individuals who are minors or who have impaired mental capacities who are unable to make informed decisions for themselves. Proxy consent occurs when an individual is incapacitated or otherwise unable to provide consent for themselves, and a legally authorized representative is appointed to make healthcare-related decisions on behalf of the person whose care is in question. Here we have examples of what assent and dissent can look like. So assent can look like a client approaching you willingly, participating voluntarily in tasks, verbally agreeing to activities, or having a positive affect or calm engagement. Dissent can look like a client saying no, turning away from you, crying, withdrawing, or escaping an activity, physical resistance, or increased distress or agitation related to a task. Dissent should always be taken seriously. Providers should take pause and evaluate whether their procedures need modification, delay, or termination when signs of dissent are present. Prior to the start of services, at the beginning of the professional relationship with clients and stakeholders, it is imperative to provide them with all available and appropriate information, including the purpose of ABA, assessment and treatment processes, lay out the risks and benefits of ABA treatment, provide alternative options, discuss the limitations of confidentiality, and explicitly state the roles of caregivers, clients, and clinicians throughout the treatment process. During conversations regarding informed consent with clients and caregivers, clinicians should always be sure to communicate in a manner that is developmentally and culturally appropriate for the individual consenting. Clinicians should be careful to use conversational language and avoid using technical jargon when communicating about services. We as clinicians should also be checking in regularly with clients and caregivers to gauge their understanding of the content that they are consenting to, and cultivate a trusting environment where they can ask questions and seek clarity freely. Last but not least, clinicians should take care to never coerce others into agreeing to services or actions that do not align with their personal values and priorities. Consent should be revisited whenever new assessments or treatment procedures are being introduced into a client's behavior intervention plan, when the intensity or restrictiveness of interventions change, when environmental variables change, when new risks become present, if there are changes to the service delivery format with the use of technology, when client dissent is visible, or when a character expresses confusion regarding a task or procedure. With informed consent, it is crucial to document who provided the consent, what was consented to, the date and time of consent, the questions asked and answered during conversations with clients and caregivers, whether there was agreement or refusal of specific services, the limitations of consent or confidentiality, signs of client assent, and all follow-up conversations had after consent has been given. Documentation methods include signed consent forms, signed insurance session notes, treatment plans, service communication logs, and any electronic health records. Not adhering to the legal and ethical processes relevant to gaining informed consent from clients and stakeholders can lead to dire consequences, including but not limited to client distress, traumatic experiences, withdrawal from services, damaged relationships with clients and their families, professional misconduct related to the Ethics Code for Behavior Analysts, legal issues for clinicians, lack of individualized and socially significant treatments, and a lack of procedural fidelity and treatment integrity throughout service delivery. Throughout your practice of ABA, there are a variety of factors that can lead to gray areas with the boundaries of consent. Situations in which consent can be ambiguous include instances where caregivers sign consent forms but do not appear to truly understand the treatment procedures, when a client complies with interventions but expresses physiological or behavioral signs of distress, if one parent consents to treatment and the other parent does not, when client assent becomes less apparent or changes over time, when a third party requests procedures or information without the clear legal authority to do so, or when the use of technology and service delivery extends beyond the confines of the original services that were consented to. In order to mitigate confusion and provide clarity on ambiguous circumstances regarding informed consent about treatments and procedures, clinicians should pause on making changes to interventions and re-explain to clients and caregivers the details of the intervention, along with the risks and alternative options available. Throughout these conversations, clinicians should be checking in with caregivers for their understanding of each component of the proposed service. Ambiguity in the process of receiving informed consent should be documented, along with all of the steps taken to resolve that ambiguity. If the ambiguity persists after revisiting information with the consenting party, clinicians should consult supervisors, qualified administrators, and legal guidelines when needed. Persistent ambiguity should also be met with more actively seeking assent from clients during treatment implementations, as well as prioritizing the least restrictive, autonomy-affirming practices while awaiting clarity and understanding from all parties involved. Working in ABA, we must take special care to always consider the factors involved in providing high quality and affirming services for our clients and their families. We work with individuals who have limited communication skills, cognitive deficits, adaptive support needs, histories of trauma, and who exist in a great variety of environments. With this in mind, promoting ongoing consent means prioritizing visual supports, sensory accommodations, and plain language when communicating with clients. With both clients and caregivers, clinicians need to balance evidence-based clinical judgment with cultural and family values. We should also always keep in mind that compliance is not the same as meaningful engagement with services. Here we have some strategies for promoting clear and meaningful consent throughout services. Always be sure to offer clients choices whenever possible and teach them how to ask for termination with phrases like no or stop. Treatment routines should be individualized for the unique needs of each client and take an approach that is sensitive to any adverse traumatic histories clients and their families may have. Throughout the treatment process, it is also important to implement preference assessments regularly to promote assent and active engagement from clients. Consistent communication with caregivers and stakeholders is also an important component of facilitating continued informed consent. And of course, we must always be cognizant and observant of client signs of assent or dissent during sessions. Here we have some resources that will provide information regarding informed consent and related topics within the field of ABA. We have a handout for the BACB Ethics Code for Behavior Analysts, as well as an ethics toolkit for the continuity of services. We will be referencing this for our following case examples. Here we have case example 1. A parent has signed the service agreement during direct session. A service agreement. During direct sessions, the child cries, scratches himself, and attempts to leave the table when work begins. We will discuss the following questions as a group. Here we have case example 2. A BCBA wants to begin a more intrusive behavior reduction procedure that was not clearly described in the original discussion regarding informed consent. We will discuss the following questions together as a group. And here we have case example number 3. A clinic wants to record sessions for supervision and training, but the caregiver previously consented only to in-person treatment services. Again, we will discuss the following questions altogether. Key takeaways from this presentation is that consent is foundational to ethical and effective ABA practice. It is ongoing and specific to each client's needs. Legal informed consent and client assent are both equally important. Ambiguity should always trigger clarification, not assumptions made. Strong consent practices improve client outcomes, promote safety for everyone in the service process, builds trust, promotes ethical integrity, and ensures the social validity of treatments implemented. Here we have some more discussion prompts to get us thinking about practical applications for obtaining and maintaining informed consent and assent in our daily ABA work. In conclusion, in ABA, consent is integral to treatment quality. Respecting consent, assent, and client dignity strengthens ethical practice and helps ensure that behavior analytic services are truly improving our clients' quality of life, as well as that of their family members. Thank you very much for attending today's presentation. If you have any questions, please come to me afterwards.